Greetings everyone. Dr. Peterson and I welcome you back to the practice. We have made numerous changes both in procedures and also in equipment to provide an environment that's safe for all of us. We look forward to seeing you soon. Thank you.
Prior to your appointment, you will receive a phone call or text from our dental team. We have been asked by the Department of Health to pre-screen our patients with the following health questions. Have you had a fever in the last 14 days? Have you recently experienced a shortness of breath? Do you have flu-like symptoms such as fatigue? Have you recently lost your sense of taste or smell? Have you come into contact with a patient with confirmed COVID-19? Or have you traveled in the last 14 days? Based on your answers to the screening questions, we may ask that you reschedule your appointment to a future date for your safety and ours. We will be disinfecting the reception room and the administrative area several times throughout the day to ensure that your environment will be safe. When you arrive in our parking lot, please call us and let us know that you have arrived. We will be asking the health questions again. Have you had a fever, shortness of breath, flu-like symptoms, loss of taste and smell, come into contact with a patient with confirmed COVID-19, or traveled? If the answer to those questions are no and the clinical team is ready for you, we will ask that you come right into the office. If you are early or we are not quite ready, we will ask that you remain in the car and we will call you when the clinical team can seat you. We ask that your friends and relatives stay in the car during your dental visit rather than coming into our reception room. Of course, the exception to that request is if a child needs to be accompanied by a parent or a caregiver needs to escort a patient. Please wear a face mask into our facility. When you enter the reception area, please come directly to the front desk. You will have your temperature taken by our administrative team. This will be done with a no-touch infrared thermometer. If you have someone accompanying you, we will take their temperature as well. Please feel free to use the hand sanitizer at the front desk on your way in and your way out of the office. Rather than taking a seat in the reception room, a clinical team member will escort you to the treatment area. UVC light bars have been added to our clinical areas for additional sterilization of the treatment rooms following a patient appointment. Additionally, we have added medical-grade air filtration systems to all of our rooms. These filtration systems will improve the air quality in our treatment rooms by filtering the air of bacteria, viruses, and allergens. Prior to your procedure, we will ask you to use a special rinse that helps to decrease the amount of bacteria and virus in your mouth. Our clinical team is now wearing gowns, gloves, masks, hair coverings, and face shields if we expect the dental procedure will create spray and splatter. Gowns, gloves, masks, and hair coverings are disposed of at the end of treatment. Protective face shields are disinfected after each patient visit. We continue to use laser therapy with all of our periodontal procedures. The laser has the ability to kill most bacteria and viruses in the oral cavity. This is an important feature to help reduce the amount of virus that is aerosolized during dental treatment. We are attempting to cut down on the amount of time you spend in the business area when checking out with our administrative team. Therefore, whenever possible, your hygienist or your dental assistant will make the next appointment for you in the treatment room. Additionally, we would like to keep a credit card on file for you, which will reduce the need to handle credit cards, checks, or currency at the front desk. You can verbally give our administrative team permission to make a payment on your credit card as you pass by the checkout area, and we will email you a receipt. As a result of the AIDS epidemic in the early 1980s, the dental profession has always utilized the Center for Disease Control guidelines for universal precautions. That means that we treat all patients as if they have the active AIDS virus, or in this case, the COVID-19 virus. Since the early 1980s, we have always used either disposable products or instruments that can be heat sterilized. plastic barriers that cover x-ray and patient chair control buttons, overhead light handles, chair seat cushions, computer mouse and keyboards are changed after each patient. All hard surfaces, including dental equipment and countertops, are wiped down with disinfectants at the end of each patient visit. The protection of our patients and our staff is of the utmost importance to us. We are excited about being able to treat our family of patients again. We are ready to provide your oral health care in a safe and comfortable environment. Please let us know if you have any questions prior to your appointment. We can't wait to see you.